Good afternoon, Richfield, or I'm sorry, good morning, Richfield. My name is Esteban DuranBallen. I'm the COO here, and I'm happy to talk to you today. Happy New Year. First of all, these are my first 11/11 of the year, so I wanted to start out with the good news first. So Happy New Year's. Unfortunately, as we continue to see the cases of COVID rise, I'm sure you've seen the news that we have broken the record of cases in a single day for COVID in the country. We are being affected by it here at Richfield as well. So I wanted to talk about that today. I know there's a lot of questions. I'm going to try to get to all the questions that I've had. And of course, if there's any other questions that come up later, please message me, email us at info@richfieldliving.com, or contact your building manager, and we'll be happy to answer any questions. First of all, I hope you're all doing well. There's, like I said, a lot of cases going around, so I hope everybody's staying healthy and staying safe. This is the most cases we've seen in a long time, so we are kind of back to it. And here, I told somebody I was coming in here, it's here we are 2022 and still talking about COVID. So I hope this doesn't last very long. But I guess I'll start with updating on where we are with the number of cases that we have on campus. Everybody's aware. But I'll tell you that before I said that, I do want to add that this is changing daily. And if I had given this update yesterday morning, it would be different than it is today. So, and it's going to be really, really hard to get you everybody the up-to-date last-minute information every time. So I'm going to talk about how we're going to be informed and when's the best time to check if you want to have the latest numbers. So I'll tell you what we have as of right now. We do have 3 buildings that have an active case. That means a resident that lives in that building has a case. So that is at the Oaks Assisted Living, at Ridgecrest, and Lake Retreat. We only have 1 at Lake Retreat. We have 4 at Ridgecrest and 5 at the Oaks. We do have team members in all areas that have tested positive, and they're quarantined at home. So they're not an active case necessarily because they're not on campus, they're not in the building, and they've been isolated, and we've done the contact tracing, and anybody that they would have had contact with has followed the correct procedures to test or isolate accordingly. So to answer your question of how many team members we have, that's literally changing by the minute, unfortunately. But we do have cases in all areas. So we've had cases in both health centers, both assisted livings, and in the independent living / resource team. Again, if you've had contact with one of these people that have tested positive, you would have been contacted already, and we would have started your testing procedure or protocol or asked to quarantine, depending on the case. And so if I want to emphasize this because this is really important, if you've been exposed, we've already done the contact tracing, you would have been notified already. And we'll continue to do that as we go on, but we will, so we'll contact you if you have been involved with anything like that. The team members are isolating at home, like I said, so they're not here. We are testing, and there's new rules that the CDC put out last week, right after the holidays, or in between the holidays. And so we are going through them, and if you think it was confusing before, it just got a little bit more confusing, unfortunately. So the rules are a little different from residents than they are for team members. For all team members, we are considered healthcare personnel. So those are not the same rules as the ones you probably see on the news for quarantine and isolation. So for residents, you do follow those general guidelines of the CDC. For team members, the rules are slightly different. So I'm going to cover just the residents to not confuse everybody with all these rules. And if the team members have any specific questions, we're going to be addressing with their managers, supervisors. But I want you to know that it's different rules in case you have questions about why is this person out longer than so and so. And the rules are different. Every case is different. I'll promise you that we're taking every precaution we can and taking this very seriously. So, all right. The first question is what do I do if I test positive? So if you test positive, whether it's a rapid antigen test or a PCR test, you need to start isolating right away. You need to let your building manager know. So Tina, Jesse, Desi, or Susan, Whitney, Rebecca, let somebody in your building know, hey, I've tested positive. You call them. Please don't come see them in person if you're positive. Call them and let them know. If you can't reach them, call me, call somebody and let them know. And you need to isolate for 5 days in your apartment without seeing anybody else, without coming out. We will bring food to you. If you let us know, we'll help you out as much as we can. But that is the best way to do it. That's the new guidelines, is 5 days plus another 5 days of masking and social distancing. So we are really is 10 days of masking, social distancing, staying away from it. The first 5 days are the most critical for you to be isolated from others. So safest thing to do is to take 10 days and just take those 10 days. And the way you count it is the day you start your symptoms is day 0, and you can come out on day 11. Again, if you have any questions about your specific case, I'm happy to walk you through it. There is no, once you've tested positive, there's no need to test again or to try to see when you're negative. Some people are going to continue to test positive even if they're not contagious, and some people may show negative even if they are. So it's once you're positive, and we'll treat that isolation like that. Second question is about exposures. So we just covered about if you test positive, you have a positive test. So now if you're exposed to somebody that has COVID, again, if this happens in Richville, we will let you know. But if you're out with family or have had an exposure, here are the rules. And again, we can help you with this because it can get a little complicated. And I have to have a cheat sheet for this one because it's the different rules for each person depending on their vaccination status. So there's 2 groups of people. If you've had your booster, or if you've had the Johnson & Johnson in the last 2 months, or if you've had the Pfizer and Moderna's shots in the last 6 months. So the way they're saying, if you're recently vaccinated, which recently vaccinated is 6 months for the Pfizer and Moderna, 2 months for Johnson & Johnson, or you've had your booster, which is the 3rd shot typically, and you've been exposed to somebody with COVID, you do not need to quarantine and isolate. You do have to wear a mask and try to social distance for 10 days. And it's recommended that you test on the 5th day. So again, that's if you've had the booster and you've been recently vaccinated, mask and social distance for 10 days, test on the 5th day. If you're not vaccinated at all, or if you only received the Pfizer and Moderna more than 6 months ago, or the Johnson & Johnson more than 2 months ago, then you do have to isolate for the 10 days, and it is mandatory that you isolate for the 10 days, and we test you on the 5th day as well. Again, once you test positive, you go into the first rules that I covered first. This is only if you've been exposed and you're asymptomatic. If you're symptomatic or you test positive, you just have to isolate for 10 days. I wish I had a live audience to see if I have any questions, but it's just me and Vicky over there. So I hope that's clear. Again, the main thing to remember is to contact us, let us know. We'll walk you through the process, and we will help you try to determine that. Every case is different. What's an exposure? And then, if I live with somebody that's exposed, it's slightly different than just walking by somebody that's exposed versus living with somebody else that was exposed. So I don't want you to get overburdened with this. We can help you walk through this. Best thing to do is really just, if you're in doubt, just stay in your room, stay in your apartment, give us a call, and we'll help you out. There's no need to risk anything during this time. If you do need to get tested, so if you have any symptoms or you've been exposed, we do have testing available on campus. We can have somebody come test you. Now, I can't promise you that it's going to be 24/7, around the clock, anytime. We'll do it as soon as we can. We should have somebody on campus that can test at any time, but there's a lot going on, and we don't want to cross too many buildings right now. So we will do the best we can to get to test you as fast as we can. There are other testing options available. I know a lot of them are backed up right now, so we don't have that problem. We have plenty of tests here and availability to other tests as well. So if you need to get tested, again, contact your building manager, or contact Pat Martin, and somebody will come out to your apartment, get you tested, or help you test yourself, whatever the case may be. And then we will follow up with the results accordingly. So that was the question. What about testing on campus? Yes, we do have that available, both the antigen and also the PCR. Our procedure or protocol right now is to use the antigen test right away, because you get the results within 15 minutes. And depending on the other levels of exposure, depending on those results, we may follow up with a PCR or not. PCR takes a little bit longer, as you know. Other questions were, one of the questions I got was, why are we not wearing the masks? And we are. I'm not right now. I have it with me because I'm isolated from everybody else right now. But if everybody should be wearing a mask at this point. A few months ago, we did decide that we're not going to mandate masking for our residents living here. I still believe in that. This is your home. You're the residents here, and we can make you do stuff like that. Many have had the choice to get vaccinated, and you've taken the steps to be protected. But with the rising cases that we have right now, we are going back to enforcing masks pretty much across the board. Team members, we've been wearing masks across, and we should have been wearing masks the whole time. So if you see something like that not happening, please let us know. I know it's hard. I know sometimes it could be hard to breathe and hard to do your job like that, but it's the easiest thing we can do to protect each other and ourselves. We are not doing the temperature screenings at the entrance of the IL buildings. That has been proven to not be a huge determinant. If somebody has temperature, they're probably not feeling well enough anyways, and they would have had other symptoms. We've tested in thousands and thousands of times every day to lots of our staff and residents, and really hasn't revealed anything. That's not one of the guidelines, none of the recommendations at this point. If that changes, we will address that and go accordingly. So, the last thing I want to cover, which I think is very important, is visitations. So, and activities, gatherings, and all that. We have canceled all activities and group gatherings for the rest of this week through Sunday. There's some activities that we are able to hold virtual, like this 11:11, anything like town hall, chapel service. We'll do the virtual options. Other activities may have, the others just unfortunately have to be canceled for the time being. And we are going to make a decision week by week, given our current situation. So right now we've gone through this Sunday, canceled everything that is a group gathering or a group activity. And then we will reassess and reinform everybody by Friday what the plan is for the next week. So in a couple of days, we'll let you know. I know we have a few big activities next week, so we'll let you know if those are going to happen or not. I can tell you right now it's probably not, but we'll make an official announcement by the end of the week. We want to be systematic about this and objective with the number of cases, where they are, or what's the number of cases in the community. Right now, the transmission rate is through the roof, and it's just something that we need to be careful. So, yes, Vickers reminded me that includes the exercise classes. Yes, so exercises, classes, anything like that is a group gathering. So whether it's a social gathering, wellness gathering, anything like that, those unfortunately have to be canceled. And I know that's not ideal, but right now with the cases so high and with cases in all the buildings, it's the best thing we can do to prevent this. There are some rules out in the community. You may be able to do differently, but we have to remember that we do live in a community here at Richfield, and we all share living space and working space with many others, many who have other underlying conditions. So we just have to. That's part of living in a group, in a society, which is it's very good, but it comes with that responsibility as well. The one thing that we're not going to do, as far as we can tell, I don't want to make too many definitive statements because CDC changes rules all the time, but we're not going to go back to where we were close to 2 years ago and cancel all visitations or anything like that. We want to keep visitations open. We have seen the negative side of that. I think society, we've all learned that was not necessarily the best thing, and I agree with that. I think we need to allow visitation, allow you to see your loved ones. I think that's something that we'll continue to do. We are encouraging or discouraging the visits as much as possible, especially in the buildings that have active cases. There are some wings and some areas that are very, very close to visits, but for the general population, if you want to visit your loved one, just talk to your building manager. If your loved one's in the assisted livings and the health centers, call ahead, find out what the situation is. But we really want to try to keep the visits open, keep all the options open to visit. There's a risk in everything we do, and I think there's also a risk in overreacting the isolation side and causing more harm in that end. So we're trying to balance that as best as we can on a case-by-case basis. But I know that comes up with a lot of questions. If you don't want to visit, if you don't think it's the right time, we completely agree and encourage you to stay home and wait till this wave kind of slows down a little bit. So that's, again, we don't know what's going to happen. We've seen the trend. This seems to come in waves. This seems to be mostly the Omicron variant from everything we're hearing about. We're not doing the genetics testing of all of our tests here, so we don't know exactly what's on campus, but it seems to be the Omicron variant. The good news from everything that we're seeing so far is that it is a milder case of sickness once you do get it, but it is much more contagious. So people are getting through it quicker, and that's why the CDC has lowered a lot of these requirements from 14 days to 10 days. But it is, it's still a virus that can affect a lot of residents and a lot of team members differently, so we have to be very conscious of that and try to do the best we can. So, anything else? Any questions? All right. Well, we'll continue to give you updates. It may be me, maybe somebody else using 1111s, using Well Nested, using any emails, anything like that, the website, and the hotline number. So those are the best places to get the most up-to-date information. Like I said at the beginning, if you want to know how many cases we have, the website we're going to do our best to keep it up to date. It may not be up to the minute, but it will be probably up to the last day or 2 days at the most. And again, our focus, our priority is going to be on, once we identify a case, we have to inform everybody that's been around that person to isolate and test accordingly. And then we'll inform everybody else so everybody knows what's going on. There are signs in front of the buildings that have a positive case, just so you know. This could be one case, it could be more. We just have to post a sign saying, there is an identified case in this particular building. So if you need more information on that, let us know, give us a call. But please just stay safe. The best thing to do right now is to try to limit your outings. If we can help you with anything like that, if we can help you get groceries or anything like that. Dining is closed at the Anza Cafe here in the dining room, so that means the dine-in, sitting down and eating there, it's closed at the moment, again, for this week at least. But the carry-out and delivery is an option. So if you want to do that, please let us know. We'll be happy to bring the food to you, or come by, get your food, and go in your apartment, or go eat outside if it's not too cold. But unfortunately, we have to close the dining room as a precaution as well. So. Yes, all the gathering areas, the roost, the Regency room, the Chandor room, all those should be pretty close because they're common areas. The lobbies and where people gather, we are pretty much restricting that to just through traffic and not people spending too much time there. Again, I hope to have much better news next week, and that we start on the upswing or the better news week by week, but right now the cases are pretty high. We're thinking everybody got together for the holidays combined with the Omicron variant hitting the United States. So hopefully this won't last very long, and we would get through it with healthy and better immune systems. So hope you'll stay well. Please reach out at info@ritualliving.com if you have any questions. You can call me, email me, or anybody in your buildings as well. Y'all take care.
Brushes and paint made the old house habitable. A Roanoke hospital donated